Gestational diabetes is when women cross a line and we think that they're too slow in processing their sugar and their sugar becomes a little bit too high in their blood. So all women, when they become pregnant, their blood sugar goes up a little bit and they process it a little bit slower. And we think this happens to give the baby an opportunity to get some sugar. So what happens is a mother eats something with sugar in it, whether it's real sugar or carbohydrates that get digested into sugar, and then it gets digested and put into her bloodstream. And it usually would go directly from her bloodstream into her muscles and into her liver. However, when she's pregnant, the placenta releases hormones that slow this process down, and we think that happens so that the baby has an opportunity to get some sugar. What's interesting about gestational diabetes is it generally has no risk for the mother herself. Having slightly elevated blood sugar for a few months in pregnancy is not really harmful to her in any way whatsoever. The main reason we care about gestational diabetes is that the baby could end up taking too much sugar and then could become too big. And if the baby becomes too big, sometimes called macrosomia, it can cause certain problems for the baby. Number one, there's an increased risk of C-section because the baby may be too big to fit. Number two, there could be an increased risk of birth injury. When the baby does come out for a vaginal birth, there's a higher chance of injury if the baby's too big. But even if the mother is scheduled for a cesarean delivery, the other problem is that if the baby is used to a lot of sugar inside, the baby's not a diabetic. So the baby inside will make a lot of insulin to process that sugar. And then after birth, the baby has all this insulin around, but has no sugar coming in, or at least not as much as when the baby was inside. And then the baby becomes hypoglycemic, or has low blood sugar, and ends up having to stay in the hospital for several days until the blood sugar normalizes. In order to treat gestational diabetes, we start simply by adjusting the mother's diet, eating less carbohydrates, more proteins and fats, and also substituting some whole grains and some brown rice for white flour-based carbohydrates can help in probably 80% of women, and that was all she'll need to do for her gestational diabetes in pregnancy. For the 20% for whom that does not work, we generally can put them on various medications, whether they're pills or whether they're injections of insulin, to keep her blood sugar normal. Typically, she stops these right after she delivers, and then she gets retested for gestational diabetes about 6 to 8 weeks after delivery to make sure that it's gone. Women who have gestational diabetes during pregnancy, it's important to note, have an increased risk of diabetes in their lifetime. And so having gestational diabetes should become a part of a woman's medical history. When she sees a doctor and he or she asks, do you have any medical problems? She could say, well, I have asthma, and when I was pregnant, I had gestational diabetes. And then her physician will know that she's at increased risk and needs to be screened more frequently than she would have otherwise.